Does your mouth feel dry the moment you wake up, before you have done anything to cause it? Not the dry from sleeping with your mouth open. The kind that a full glass of water improves for 10 minutes before it quietly returns. If that is your morning, this video is specifically for you. The first explanation most people reach for with persistent morning dry mouth is dehydration. They drink more water, place a glass by the bed, reduce caffeine, and the dry mouth continues through every intervention because the cause has nothing to do with fluid intake. Persistent morning dry mouth that improves temporarily with water and then returns is not a hydration deficit. It is a symptom pointing toward 4 possible causes, each a distinct biological mechanism, and each worth understanding, because 3 of the 4 are actively investigated in other clinical contexts, while their connection to what you feel every morning is almost never made out loud. Subscribe before we go through the conditions. There is a specific accumulation of small adjustments that builds up quietly around this symptom over time, none of which ever gets named as a management strategy. The glass of water that permanently lives on your nightstand now, placed there deliberately rather than casually. The sequence of your first 10 minutes in the morning, drink first and everything else second, because without that, the day starts on the wrong note. The pack of mints or the gum that has found its way into the bag, the car, the jacket pocket, because certain conversations are uncomfortable without them, and you have stopped being able to say why without it sounding like more than it is. The quiet calculation before any commitment that requires sustained talking, whether there will be water available. None of these feel like adaptations to a medical symptom. They feel like personal preferences. They are preferences that did not exist 5 years ago, and they have gathered around something you have been calling dry air, or dehydration, or just the way mornings are now. Here is how dry mouth is typically managed when it does get raised at an appointment. It is noted, attributed to one of several common explanations, and the patient leaves with advice about drinking more water, using a dry mouth spray, or trying a humidifier. The clinical investigation ends there. What almost never happens is a differential that connects persistent morning dry mouth to the 4 specific conditions described here and asks which one is present. Dry mouth is treated as a quality of life complaint rather than a symptom with diagnostic implications. For most adults over 60, it will not generate a salivary antibody blood test, a postprandial glucose measurement taken because of that specific symptom, or a complete medication review conducted with morning dry mouth as the primary presenting concern. The first condition is an autoimmune disease called Sjögren's syndrome, and it affects an estimated 4 million adults in the United States alone. The overwhelming majority of them, women over 40, with an average time from first symptoms to correct diagnosis of more than 6 years. In Sjögren's syndrome, the immune system attacks the moisture-producing glands throughout the body, primarily the salivary glands and the lacrimal glands that produce tears. The result is persistent dry mouth and dry eyes that are not explained by environment, fluid intake, or any other obvious cause. Research published in Arthritis and Rheumatology confirmed that salivary gland function is measurably reduced in Sjögren's syndrome, and that morning is consistently the most symptomatic period because the glands have been inactive overnight without the mechanical stimulation of eating and speaking. The 2 findings that most specifically suggest Sjögren's alongside morning dry mouth are dry, gritty eyes that worsen in wind and on waking, and joint aches that shift between different joints from day to day without a clear physical cause. The second condition is blood sugar dysregulation, and the mechanism that produces dry mouth here is physical and direct. High blood glucose draws water from cells throughout the body through osmosis, including from the cells of the salivary glands. When salivary gland cells are losing water to the bloodstream, saliva production falls and the mouth becomes persistently dry, most noticeably in the fasting state of early morning before the first meal of the day. Research published in Diabetes Care identifies persistent morning dry mouth as one of the earliest and most consistent oral symptoms of prediabetes and type 2 diabetes, noting that it frequently appears years before the blood glucose level crosses the clinical diagnostic threshold. The distinguishing feature of this condition, alongside morning dry mouth, is a thirst that persists through the day, and that water satisfies temporarily but does not resolve, combined with a gradual increase in urination frequency compared to how things were 2 or 3 years ago. The third condition is obstructive sleep apnea, and it is the one flagged in the title for the reason that its consequences extend well beyond the mouth. People with sleep apnea frequently breathe through the mouth during apnea events as the body attempts to maintain airflow around a partially obstructed airway. 8 hours of mouth breathing overnight removes the moisture content of the oral mucosa reliably by morning. But the connection to dry mouth runs deeper than the mechanical breathing pattern alone. Research published in the Journal of Clinical Sleep Medicine confirmed that autonomic nervous system dysregulation from sleep apnea impairs salivary gland function independently of mouth breathing, producing dry mouth even in people who sleep with their mouths closed throughout the night. The same autonomic dysregulation that impairs salivary gland function is the opening mechanism in a cascade of cardiac changes, structural heart remodeling, elevated inflammatory markers, and arrhythmia risk that the dry mouth is giving you your first visible surface of. Morning dry mouth in the presence of daytime fatigue, despite adequate hours of sleep, morning headaches, and a partner who reports snoring or observed pauses in breathing is a pattern worth raising with a doctor as a complete cluster rather than as separate, unrelated complaints. The fourth condition is the most common of the four and the one most likely to have a direct and immediate pathway to resolution for someone watching this video. Over 500 medications list dry mouth as a documented side effect. The medications most commonly associated with it are among the most widely prescribed to adults over 60. Antihistamines, antidepressants, blood pressure medications, including both diuretics and calcium channel blockers, bladder control medications, and anxiety medications. Research published in the Journal of the American Dental Association established that the prevalence of medication-induced dry mouth increases sharply with the number of medications taken simultaneously, affecting the majority of adults taking 5 or more daily medications. Most patients taking these medications were never told that persistent dry mouth was a documented consequence. Most prescription reviews conducted in standard appointments have not connected the dry mouth being raised in one part of the visit to the medication list reviewed in another part of the same visit. The protocol maps your secondary symptoms to the most likely condition and tells you the specific investigation to request. For Sjogren's syndrome, the additional symptoms to look for are dry, gritty eyes that worsen in wind and on waking, joint aches that move between different joints from day to day, and fatigue that seems disproportionate to what you have done. If 2 or more of those are familiar alongside the morning dry mouth, the investigation to request is a blood test for SSA and SSB antibodies, also called anti-Rho and anti-LA, requested specifically rather than as part of a general autoimmune panel. For blood sugar dysregulation, the additional symptoms are thirst that persists through the day, increased urination frequency over the past 2 years, and energy that drops sharply in the afternoon, particularly after starchy meals. If those fit, the investigation to request is a postprandial glucose reading taken 2 hours after a standard meal. A fasting glucose alone misses the spike and crash pattern that produces this symptom. For sleep apnea, the additional symptoms are morning headache, daytime fatigue regardless of hours slept, and a partner or family member who reports snoring or pauses in breathing. If those fit, the investigation is a referral for a home sleep study or overnight oximetry, requested alongside the dry mouth and fatigue as a cluster rather than as separate concerns. For medication-induced dry mouth, the investigation is a complete medication list review with the specific question asked out loud. Which of these are documented to reduce salivary flow? Bring the list to your appointment, include any over-the-counter antihistamines taken regularly, and frame the request as a xerostomia review. That framing produces a different conversation than reporting that your mouth is dry. 5 steps. 2 of them tonight. 1. Write down every medication you currently take tonight, including any over-the-counter antihistamines or occasional medications. That complete list is the starting point for Condition 4's investigation. 2. Check for dry, gritty eyes tonight before bed. Run your finger very lightly across your closed eyelid. If the surface feels rougher or drier than it should, note it alongside the morning dry mouth. That pairing is the specific clinical signal for Condition 1. 3. Track your thirst pattern tomorrow. Does the dry mouth resolve by mid-morning or persist through the day? Persistent daytime thirst alongside the morning symptom is the distinguishing feature of Condition 2. 4. At your next appointment, describe this as persistent morning xerostomia of approximately this duration and list the secondary symptoms you have identified from this video alongside it. That language is significantly more clinically legible than saying your mouth is dry in the mornings. 5. Send this video to one woman over 60 in your life. Sjogren's syndrome affects women predominantly and has an average diagnostic delay of over 6 years. This video covers what those 6 years feel like from the inside. First, which of the 4 conditions do you think most likely applies to your situation? Not a diagnosis, an instinct based on what you have just heard. Write the number. Second, write the secondary symptom, not the dry mouth itself, but one other symptom from the description of that condition that made you choose that number rather than another. That second detail is often the observation that has been sitting in the background without a framework to attach it to. Your age and where you are watching from alongside both answers. The condition that appears most frequently in these comments tells me which of the 4 needs its own dedicated video next, and that video will be written for exactly the person who recognized themselves in this one.